Hi, I'm Dr. Sherwana Davis with the Georgia Mind Center, and today I'll be tackling the topic of the 5 myths that keep people from seeking therapy. Stay tuned. Let's explore the 5 common myths that keep people from seeking therapy. Myth number 1: therapy is only for the severely mentally ill. That's a myth. People of a variety of backgrounds seek therapy. Yes, there are some practitioners who actually see clients in psychiatric hospitals who are the most severely ill, but there's also a wide variety of practitioners who also see people in outpatient settings as well. And many people actually seek therapy so that they don't become severely mentally ill. Myth number 2: the therapist will judge you. Therapists are trained to be objective practitioners. In many cases, they practice using unconditional positive regard when seeing clients. So, your therapist is there to objectively provide you with clinical knowledge, clinical experiences, and to practice in a clinically safe environment. So they're there to do the exact opposite of be judgmental. They're there to provide you with support, help to challenge some cognitive distortions that you may have, and to equip you with coping skills. Myth number 3: you've had a bad experience in the past, or you heard somebody who's had a bad experience in the past with therapists, and you think they're all bad. Well, just like any other service provider, sometimes you may find one that fits your needs or your particular style, and in other cases, you may not. But similar to other services, that is not a reason to stop looking for the one that fits your needs. Each practitioner comes to the table with their own unique presence and their own approach to being able to apply the clinical skills that they've obtained. So I encourage you to keep looking until you find just the right one that matches your style. I don't have a time or your schedule is not flexible. The good thing is there's teletherapy, and teletherapy provides a wide variety of options for people. There are some clinicians who only practice in the day, some who only practice at night, there's some who practice overnight, and there are others who practice on the weekend, and then there's some who do a completely different blended approach. There's some that only do in-person sessions. There are some who only do virtual sessions. There's some who will actually come to you. And so this means that you have a lot more options than you may think. When you're looking for therapists, make sure that you're exploring those options about flexibility and the times that they offer their sessions. And you may be surprised that you can find one to meet what your needs are. Myth number 5: I won't be able to find a therapist who understands me. The good thing about finding a therapist is that most therapists understands the need to practice with cultural humility, and they seek to be culturally competent. They're there to understand you as an entire person, not just your presenting symptoms, but who you are as an individual. That is a key component to practicing therapy. And so when you're seeking out your therapist, in some cases, particularly if you're going to different directories for psychotherapists, you can find in some of those directories, they actually highlight some of the areas that they may be proficient in. So you can find therapists who specialize in treating people with your religious preference or your gender identity or your sexual preference, or if you are married or single, or if you're a parent. There's a wide variety of therapists out there that's ready to help and support you. Hopefully, you found this information helpful. And remember, you deserve peace of mind.